Great. I'm going to go ahead and get us started. So welcome everyone to our ethics grand rounds for this month. And I'm really thrilled that this month I get to introduce Julie Kabat here to give us a little bit of maybe a more medical humanities angle on some of the questions that we look at. So we're really thrilled to have Julie here. Julie Kabat is the author of Love Letter from Pig, My Brother's Story of Freedom Summer. This was published by the University Press of Mississippi, and the book addresses ongoing issues of civil rights and racial inequality facing the nation today. Ms. Kabat has toured internationally as a composer, performer, singer, and a storyteller, and she previously worked for over 40 years as a teaching artist in public schools. Julie, Ms. Kabat, we are very thrilled to have you here. We welcome you to our Ethics Grand Rounds and are excited to hear about your book. So I'll hand it over to you, and then whenever you're ready, I can kind of moderate a Q&A session at the end.
Terrific. Thank you, Johanna. So, hello. I am neither a physician, obviously, nor a bioethicist, but again, I am a storyteller and musician. So I'm going to share the screen and we'll get into this talk. Okay. So today's talk is Lessons in Social Justice and Medicine from Freedom Summer 1964. And I'm going to be using primarily two sources. One is my book, Love Letter from Pig, My Brother's Story of Freedom Summer. It is a memoir biography based largely on my brother Luke's letters and diary, and the nickname, he called me Pig. It was a term of endearment, not a tease, and he was the only one who called me that. On the right, you see another book, and this is my other primary source. Both of these books are published by the University Press of Mississippi. And this book is by Dr. Richard DeShazo. It's The Racial Divide in American Medicine, Black Physicians, and the Struggle for Justice in Healthcare. Here you see, on the left, Andresa Coleman, on the right, Dorothy Singletary. They happen to live in Albany, and they're part of a large family, and were known as the Thompson sisters, 7 sisters who grew up in Meridian, Mississippi. I met them in Mississippi. So in 2014, I went on a kind of a pilgrimage as I was beginning to do the research for my book, because they were holding a reunion, Mississippi Freedom Summer at 50. And in Mississippi, in a soul food restaurant, I met some of the Thompson sisters, and it turns out the two of them, Andresa and Dorothy, live in Albany, and we have become good friends. Now, surprisingly, I also met Paul Murray, who's a sociologist and professor emeritus at Siena College, who's taught many, many civil rights courses. And we were just walking across Tougaloo campus, happened to strike up a conversation, and lo and behold, he too lives in Albany. So their voices, primarily Andresa and Dorothy, are an important part of my book. So the agenda today, I'm going to start with Freedom Summer and Luke's experience. Then I'll introduce a pie chart which illustrates the social determinants of health, and we'll follow that chart to explore the impact of segregation and racism on healthcare. I have some questions to frame our talk, and the first is, what happened during Freedom Summer to open the eyes of the nation to racial injustice? Here is a poster. One man, one vote was the rallying cry for Freedom Summer. In 1964, only 6.4% of African Americans were registered to vote. You heard that correctly, 6.4%. Why? Because it was incredibly dangerous. If you registered to vote, you could lose your home, you could lose your job, you could lose your life. Now, the organization that was spearheading the voter registration in Mississippi, which was the most dangerous of the southern states, was SNCC, the Student Nonviolent Coordinating Committee, made up mostly of young adult Blacks. And they wanted to register as many people as possible during the summer of 1964. And as they were anticipating that, they came up with a plan. They would not try to register everyone for the Mississippi Democratic Party. They would start a new party, the Mississippi Freedom Democratic Party, in order to show that many Blacks did want to vote, and they were going to make sure this was a legitimate party. So they would follow every step that was needed, but they needed help. And although it was a contentious decision, they did reach out to students in the North and ask for volunteers. Now, they went mostly to prestigious colleges, and most of the volunteers, almost 1,000 of them, were white. And they had reasons for doing that, partly because these students at prestigious colleges most likely would be able to afford to have a summer without a paying job. There would be problems bringing large numbers of naive white folks into the Black communities, but they needed the help. Also, they were going to encourage these volunteers to write letters home and to their local newspapers. People around the nation were not paying attention to what was happening in Mississippi. The federal government certainly wasn't. Maybe it would be a wake-up call for the nation. Mississippi had been called a closed society. So my brother Luke is here, seated next to Fifth Street Red. And he was a medical student at Stanford. Stanford had a 5-year program and encouraged their students, because they had the extra time, to pursue scientific research and to explore special interests. That's how Luke managed to go for the summer to Mississippi Freedom Summer and be a volunteer. And our parents, of course, were terrified. So on the right, you see a letter that Luke wrote. He was sitting in a restaurant. My parents were nervous. He wanted to explain why he was going to Mississippi. I don't expect you to read this, but I do want you to know that he used the language of the day. The word Negroes had not yet been replaced by Black or African American. And I will summarize here. He desired to perform an unselfish act. I don't want to sit back while Negroes are being denied their rights. I don't want to let others do it, because it is my responsibility too. Luke believed in the philosophy of nonviolence and had been studying it. In his diary, he wrote, "I am fighting a nonviolent battle because I believe that hate begets hate, and perhaps that love begets love." When Luke's letter arrived, our parents freaked out and insisted that he come home to Rhode Island and fly across the country before he go to Mississippi. They were hoping to persuade him not to go. So what dangers and hatred did the civil rights workers and would the new volunteers face? My friend Andresa, who you saw earlier, told me that at the time, what they were hearing in the Black community was whites saying, "We got to get ready for those freedom riders coming to start trouble down here, those communist agitators. We have our Negroes under control down here." In anticipation of the summer, in the spring, businessmen in Mississippi formed the White Citizens Councils. They worked closely with sheriffs and so-called law enforcement. And as you can see here, the Mississippi Ku Klux Klan was revived. Segregationists wanted to preserve their way of life. And lest you think that this kind of hate begets hate is all behind us, or only in the South, take note. Here is a sticker that I found from White Lives Matter on a telephone pole in 2022 when I was taking a walk on a bike trail behind our home. We live in Columbia County, just a little bit south of Albany. Racism is obviously still around. Now, while Luke was home on January 22nd, there was terrible news. 3 young civil rights workers, Andrew Goodman on the left, 21 years old, had only just joined, James Chaney, local to Meridian, and Mickey Schwerner had disappeared. And LBJ, President Johnson, ordered an investigation. Now, when J. Edgar Hoover, the head of the FBI, announced that they would indeed investigate, he made it very clear, quote, "There will be no protection for civil rights workers." On the airplane, on his way to the orientation, my brother met Freeman Cocroft, another volunteer from Rhode Island who had just graduated from Yale. And he would become his close friend and roommate for the summer. At the end of the orientation, Luke was assigned to teach Freedom School. Meridian. Ugh, not Meridian. That's where Schwerner came from? What? We're going there to take Mickey's place at the community center? Good grief. What will my parents think of that? We are going to restore the community center, which was closed down after their disappearance. There is a strong obligation for us to do a wonderful job for Schwerner. Luke felt a great kinship with Mickey Schwerner. They were both secular Jews, born the same year and raised in the shadow of the Holocaust. Now, the disappearance was a tipping point. Suddenly, the eyes of the nation were on something happening in Mississippi. And within a very short time, it led to the passage of the Civil Rights Act of 1964. LBJ signed the bill on July 4th, just as Luke and his friend Freeman were riding a bus into Mississippi. Leaving the orientation, Free put it this way, quote, "At the orientation, Luke and I were told that when Mickey was alive, the Meridian Community Center was the place where Negro kids smiled. It was our desire to see them smile again and keep them smiling as often as any human being could ever be expected to smile." Now, Black children were taught and learned early to be careful and suspicious of white people. So this would require breaking down barriers. What we see in this photo is the breaking of barriers, developing trust, empathy, and love. Luke wrote, "It is only when these barriers are destroyed that any of us can find freedom." Now we're going to turn to history. In the U.S. Census in 1860, Mississippi was the wealthiest state per capita, with 436,000 enslaved people. You'll note the term enslaved people rather than slaves, because it tells the action perpetrated on these people. It's not just a noun. In 2020, in the census, Mississippi was America's poorest state, and still is, of course, and there is a relationship. Now, in 1860, Abraham Lincoln was elected president, and in the same time, the prologue to the Mississippi Document of Secession, written by planters, is, "Our position is thoroughly identified with the institution of slavery. A blow to slavery is a blow at commerce and civilization. None but the Black race can bear exposure to the tropical sun to grow these products," that is cotton. 1863, the Emancipation Proclamation, just in case, Mississippi plans to block Black suffrage. 1865, the end of the Civil War, the Black Codes are passed. Defining feature of the Black Codes was a broad vagrancy law. Local authorities could arrest freed people for minor infractions and commit them to involuntary labor. This was the start of the convict lease system, described as slavery by another name. It should sound familiar. The new Jim Crow, the disproportionate incorporation of African Americans, still today. Here is our pie chart, and soon we'll get to the medical issues. So here is a simple chart, could be a lot more detailed, but we have various categories for the social determinants of health, and we will explore each and every one of them. And although we are looking at Mississippi under Jim Crow, much of this still takes place in our country. So race and culture will underline everything. I don't have a separate slide for that, but I do for the others. And we're going to start with poverty, geography, and then move on to others. So poverty in the Mississippi Delta. So this photo was taken just a few years ago. Mississippi Delta, of course, is that area along the western side of Mississippi, the very rich soil where most of the cotton was planted. It had the most slaves, and it is, of course, now the poorest section. In the 1960s, a Black doctor characterized the health care of African Americans in the Mississippi Delta as, quote, medieval, with brutal poverty, rampant malnutrition, oppressive segregation, and a feudal plantation system. This relates to geography and history of slavery. It's, of course, an agricultural state and based on cotton. After the Civil War, freed people became sharecroppers. In the 1950s and 60s, as mechanization displaced the laborers, they were even more impoverished than before. So here's another slide about poverty today. I'm going to let you read this one. So here we come to our next question. What can we learn about social justice in medicine today by looking back at the civil rights movement, specifically at Mississippi Freedom Summer, 1964? Now, in this photo, you see the community center. It's on the second floor, and also the administrative offices. The Freedom School was a separate building. This is looking across 5th Street in Meridian, 1964. Now, when the volunteers were at the orientation, they had been warned. After you leave, the Negroes who have sheltered you may suffer reprisals. Mr. Figures was an elderly father of 10, now living alone. Luke wrote, I hate to endanger his life by staying at his house, but he is proud to be able to help in the fight for freedom. He has a resting tremor and a Parkinsonian facies and gait. I recommended that he visit a doctor, and will try to get the name of a good neurologist for him. Impossible. In 1964, there were only 25 Black physicians for the entire state. Access to care. Think about that. 25 for the whole state, and there were 2 in Meridian who were expected to serve a Black population of 23,000. One of them was Dr. Polk, And despite being impossibly busy, he made time to see Luke, and they met several times. And he explained in their first visit, "It took me 7 years to get hospital privileges in this area." So this is part of the reason for a lack of doctors, as well as the fact that Mississippi was so dangerous. So, systems of care, the AMA. Now, Dr. Smith is going to be very important to our talk. He's in the middle there. And he is in 1963 at the annual convention for the AMA outside picketing. Why? Because the AMA allowed its constituent, that is, local state level societies, to practice racial discrimination. Until the late 60s, in many Southern hospitals, Black doctors were denied hospital privileges, even when their Black patients were admitted to segregated hospital wards. It was a catch-22. To obtain hospital privileges, a doctor had to belong to the local AMA, Medical Association, which did not permit them to join. Dr. DeShazo in his book says, organized medicine was quick to call out quacks and irregulars, but slow to speak out against pseudoscience, racism, and social injustice in health. Now, the AMA was founded in 1847, and Blacks were excluded. Now, this is interesting. In 1870, Black physicians with a few white doctors founded an organization that is still going today, the National Medical Association, or NMA. You may want to check it out because it is a leading force for parity and justice in medicine, but has never had the same standing as the AMA. In 1968, the AMA finally began to expel its constituent societies for racial discrimination in membership. It was 2008 before the AMA apologized for past racial discrimination against Black physicians, and 2015 when the Mississippi State Medical Association finally voted to support the AMA apology. And still today, there is gross underrepresentation of African Americans in the medical profession. Now here we have another picture of Dr. Robert Smith. He was practicing in Jackson, the capital city of Mississippi, and after the murders, he anticipated escalating violence. He asked, who will care for the volunteers? Most Black physicians would fear retribution from the Ku Klux Klan. So he realized he needed help and turned to a group that he knew of socially conscious, mostly white, Jewish physicians from the Northeast. He put out the call and they arrived in Jackson for his orientation. 57 doctors and 41 nurses, social workers, and medical administrators. They formed a new organization at that first orientation meeting, the Medical Committee for Human Rights. And through the summer, teams of them would come, most for short stints, and they were deployed throughout the state. Meanwhile, the head of the Mississippi State Department of Health, Archie Gray, who was a vehement segregationist, said, nah, there would be no licenses for these doctors to practice in Mississippi. But there was a loophole. Administering first aid was not prohibited, and the doctors stretched the definition. As these physicians went around the state, they were shocked by what they saw. From a report in the Mississippi Delta, in child after child, we saw thin arms, sunken eyes, lethargic behavior, and swollen bellies. Homes where children were lucky to eat one meal a day. Neighbors give them scraps of food. We do not want to quibble over words, but malnutrition is not quite what we found. They are suffering from hunger and disease, and directly or indirectly, they are dying from them, which is exactly what starvation means. And Luke wrote, "You can't believe how poor these kids are. The kids are hungry. They can't afford to eat lunch. Many go barefoot. A little girl had so many holes in her dress that it hardly existed." Now we're going to turn to education and the question of health literacy. Luke described a day teaching biology in class. "We dissected a dead field mouse. I asked them questions. Why do we breathe? What is heart failure? I presented imaginary patients and explained why they had their symptoms. And I showed them what a doctor is looking for when he percusses a chest or listens to the heart or tests a reflex. I showed them skin under a microscope, and they saw that color is less than skin deep, and hardly that. I emphasized our biological closeness to other animals, as well as to the family of man. Slavery and racism were based on a mistaken notion, less than skin deep." So let me tell you a little bit about this photo, because on the left, you see a little Fifth Street Red who was always hanging on to Luke, any part of him, wherever he could. Behind him, with her hands on his shoulders, is Andresa. And then, with her hand over his shoulder, 13-year-old Dorothy, and next to her, another Freedom School student, Linda Martin. Thinking of health literacy in the evenings, Luke taught public health classes to adults. What about medical education? After World War II, the GI Bill mostly benefited white veterans, but segregationists immediately developed a plan to divert otherwise qualified Black applicants away from their state medical schools to two, Howard and Meharry. The Southern Governors Association created and supported scholarships to Meharry, and you know why. These were the Black medical schools. Now we return to Freedom Summer and a bit more of the story. The cover of my book has a photo taken August 7th, 1964. 3 days earlier, Luke's hand was shaking as he wrote this entry into his diary. "On Tuesday night, I heard the news that Cheney, Mickey, and Andrew had died. Their bodies had been found. I was sitting in front of Cheney's aunt at a concert given by Pete Seeger when he made the announcement. She looked at me with startled eyes. 'Is it true?' she asked. 'I am his mother's sister. I am his mother's sister.' My first feelings were shock, for I have been close to those who loved them. I have been working in the community center that Mickey built, and he lives there still in the minds and hearts of the kids. He worked so hard that sometimes he didn't eat for days, and when I go to Henderson's for lunch, I can feel him saying, 'Luke, get back to those kids. We've got work to be done. There's freedom to be won.' So Luke realized that the whole community was traumatized and filled with grief. James Cheney's family planned a private funeral at a church, but Luke knew everyone needed to mourn. So he and his close friend and fellow volunteer Gail Falk proposed the idea for a march that would start in different directions and converge on the church and have a public memorial outside, public service. And this also reflected Luke's deepening interest in adolescent and social psychiatry. Now, the very next morning after the march, with very little sleep for Luke and Gail, there was the Freedom School Student Convention. It had been the plan since the beginning of the summer to culminate with a student-led convention. At the beginning of the summer, students around the state had chosen topics to address. There were 6 areas, and health was one of them. So they were learning to be advocates and politically engaged because what they did at the convention was develop a youth platform for the Mississippi Freedom Democratic Party. And you see that photo on the right. The state convention held just a few days or couple days before, where SNCC and the other civil rights organizations that were involved in Freedom Summer were following every requirement for a legitimate party. And at this convention, they were electing an integrated delegation to send to the National Democratic Convention. Here is another chance that they took for mourning. When the murders occurred and the bodies were found, the parents of Schwerner, Cheney, and Goodman wanted their sons to be buried together, but that would not happen. Segregation involved everything, including graveyards. Now, here they are at the site of Mount Zion, the burned church that the 3 had gone to inspect the day they were murdered. I'm going to have us step back for a moment, though, look at the community in this photo and ask a question. In the civil rights movement, how do you build community and sustain commitment? In addition to the community center offering recreation and adult education and the freedom schools, there were public meetings in the churches in the evenings where people could talk. There were speeches, they could discuss issues, and there were songs. I would say that music was the glue, and that music has a therapeutic role to play in health and in healing. Now, with the freedom songs, there were songs to fit every occasion, and just to give you a taste, I'm going to sing just a few phrases from 3 different songs. They say that freedom is a constant struggle. They say that freedom is a constant struggle. Woke up this morning with my mind stayed on freedom. Woke up this morning with my mind stayed on freedom. Ain't gonna let nobody, Lordy, turn me round, turn me round, turn me round. Ain't gonna let nobody, Lordy, turn me round. I'm gonna keep on a walking, Lord, keep on a talking, Lord, marching up to freedom land. So, I'm going to let you read the first 4 bullets. There was a great deal of violence during the Freedom Summer. So, there were violent incidents throughout the state every day, such as 30 Black churches burned, harassment, arrests, Molotov cocktails exploding, bombings, shots fired, car chases, hate literature, beatings in jail, crosses burned, restaurants that serve volunteers threatened, Blacks fired from jobs for civil rights activities, such as attending a rally, murders, etc. Now, because of the murders and this violence, and the white volunteers who were involved and were sending letters to their local newspapers, Mississippi Freedom Summer became a tipping point. The eyes of the nation were on Mississippi for the first time, and they were especially at the National Democratic Convention. So the integrated delegation of the Mississippi Freedom Democratic Party arrived in Atlantic City, and their mission was to challenge the Mississippi Democratic delegation, whose motto might have been, "Whites only need apply." But President Johnson's goal was to maintain a well-controlled and well-scripted convention. He was perhaps legitimately afraid that if the Freedom delegation were seated, he would lose the entire South and the election. So the Freedom Democratic Party did not win, and many activists were very disillusioned. They began to question the tactic of nonviolence, to work outside the system, and it led to the rise of Black Power movement. After the convention, Luke visited home for a brief time and then returned to medical school in Stanford, at Stanford. In November, a clinical rotation allowed him to return to Meridian for 6 weeks. Unlike the summer, volunteers could now be involved in protest actions. So Luke went out with teens to test the Civil Rights Bill of 1964. Would restaurants serve them? It resulted in arrests and jail. And you can see, he took a picture of the jail. Now, when he and Free were arrested several times, they were in segregated cells, that is, with white men who were segregationists, and they were nervous about being attacked. Now, in one instance, the question of professionalism arose. When a cellmate heard that Luke was studying medicine, he confided in him that he had a heart condition and jailers were not giving him the medicine he needed. Now, Luke helped him. He felt an obligation to doctor anyone in need, no matter what his views of the man's segregationists' views were, because he had pledged to uphold the Hippocratic Oath. So the eyes of the nation, here's a little article in the New York Times. It's how our parents learned that Luke was in jail and had faced a mob and was charged with contributing to the delinquency of minors. So again, he was in a segregated cell. And in the afternoon at the county jail, because he and Free were put into different cells during that night and into the day, they were terrified because one of their cellmates heard on the radio that the murderers had been arrested on a tip the FBI had gotten. And those, many of whom were from Meridian, were brought to the same jail. Would they be put in the same cell as the murderers? So we're going to take just a moment now to move from the segregated jail cells to segregated hospital wards. It was terrible. Everything happened in one room. And I intended, but to save time, I'm not going to read you this whole thing. I'll just read you what one of the doctors wrote. Within that one room, everything took place. Surgery, delivery, pediatrics, whatever. I saw a kid about 9 years old being treated, and in the bed next to him was an old guy with tubes running out of everything with cancer. Mothers were confined in this exposed ward with their new babies. Everything. So they had 40 beds in a hospital in Jackson to serve the city's Black population of 50,000. So now we could say that Freedom Summer was a tipping point, but it did have some positive outcomes. What were some of the changes in healthcare? We get to the positive part of this. Civil Rights Act of 1964, Economic Opportunities Act, which led to the federally qualified health centers. Food Stamp Act, Social Security Acts, Voting Rights Act of 1965, Department of Housing and Urban Development. And in Mississippi, 158 hospitals integrate because if they don't, they're not going to get federal funding. And we get to a wonderful story of the Tufts Delta Community Health Center. On the right, you see Dr. Jack Geiger, who worked closely through the summer with Dr. Robert Smith. He had studied earlier in South Africa and had met doctors who had talked about and started a concept of community-oriented primary care. And it was he who helped to persuade the Office of Economic Opportunity to fund 2 comprehensive health centers to be sponsored by Tufts Medical School, one in Boston in a public housing project and one in the Delta region of Mississippi. And Dr. Geiger, would run that one. So I'm just going to tell you, he took 2 years of planning because he wanted it to involve community organizing. They built community support before they ever opened the healthcare center. And then they looked at all the social determinants of health. They started a cooperative farm that was farmed by families on 600 acres. 1,000 families farmed vegetables and provided hundreds of tons of vegetables. They had a sanitation expert. They had an OBGYN family planning, which led to a dramatic decrease in infant mortality. Just within a few years, they had an education program that the doctors and the nurses, who must have been exhausted, taught GED classes in the evenings. They produced within 8 years, 7 physicians, 5 PhDs in clinical sciences, 2 environmental engineers, 6 social workers, numerous nurses, etc., in a county that had some of the worst public schools in the country. However, with Nixon's administration, they began to have cutbacks, and all those outreach programs that he had started could not continue. Mississippi had the largest of the nation's first Head Start programs, the Child Development Group of Mississippi. And because doctors like Dr. Smith were involved, it involved a strong medical component and also grassroots organizing. I want to point out that if you're in Albany, there's the Whitney Young Health Center, which is a federally qualified health center. There are many of them across the country to treat indigent population of people. Here is the Ravenswood Center. My brother Luke died just 2 years after Freedom Summer and was not able to see a dream of his come true. But his wife, Sertiller, kept telling herself that his dreams can't die. She was on the original board of the East Palo Alto Medical Dental Clinic, now called Ravenswood Family Health Center, which has several locations and is still operating. Food for thought. These were best practices. What's needed for such changes to take hold? You need to listen to people, involve oppressed people in creating the solution. And you can't do anything as an individual. You need to work as part of a team. Heather McGee is the author of The Sum of Us. She talks about a solidarity dividend because we all benefit from inclusivity and equity. So she says, uproot the zero-sum mental model, us against them, we win, you lose. We all win with a solidarity dividend. Empathy is a strength, and tell the truth, setting the facts straight so we can move forward with a new story. And finally, of course, there's the matter of funding. We've talked about the social determinants of health. We need all of them to achieve social justice. Here's my book. It's available. If you live in Albany, you can get it at Stuyvesant Plaza, the book house. It's available and on sale right now through the University Press of Mississippi, 50% off, and you can get it through Amazon. So that's how to get my book. Here are references. I'm sure these will get sent out to you later. So I think it's time for questions.
Yeah, I'll open it up. Thank you so much, Julie. That was wonderful. Yeah, if you want to, go ahead and shut down your slides. That's great. And I'm gonna, sorry, I'm looking at my screen here so I can see participants. I'm gonna open it up for any questions or comments from our attendees. Does anyone have a question for Julie? I know there's an active chat about the National Medical Association and the student there. Albany Med has, Julie, you may not know this, but there's an active student chapter of that here at Albany Med. So,
Oh, that's great.
So
I'm
that-
delighted to hear that.
yeah.
You know, I had a wonderful conversation, a Zoom session with Dr. DeShazo. And, you know, Dr. Robert Smith is still alive and he's retired. He's in his 80s, but he's still active, still working. So I'm delighted to hear that.
I'll ask a question, I guess. More of a, comment. I mean, we've discussed this a lot actually, but I mean, the idea of young white students in 1964 going to the South, the segregated South, the Jim Crow South. I mean, I was a teenager then, probably 10th grade or something, 9th, 10th grade. And I remember the racism was palpable, and as well as just the possibility of being harmed if you were from the outside. I remember well some of the old guys, including my father, talking about those agitators from up north coming down causing trouble. And I just wonder if Luke and others like him had any earthly idea what they were getting into, because
No.
it was I mean, it was terrifying for me as a teenager, and I lived there.
Yeah, no, I don't think so. And I think that at the orientation, they tried to scare volunteers away because they knew how dangerous it was, and they only wanted people who were really committed. And Luke did write in his diary, you know, what is old Luke signing up for? It's a rougher situation than I had anticipated.
I would assume that there was a screening process, much like Physicians Without Borders. You know,
Absolutely.
this is
Absolutely.
not for everybody. This is for a few people with an incredible commitment who's willing to literally risk their lives and go. I mean, literally go into a war zone.
That's right.
That's what it was.
There was a lengthy application, like 20 pages or something like that. You had to write like a narrative of why you wanted to participate. And they did warn them about violence. I think one of the strategies was like if African Americans were subjected to violence in Mississippi, it didn't really make national news.
Right.
If white students from the North were subjected to violence, then it would make the news and it would bring about like national media coverage.
And it did. And Rita Schwerner, Mickey Schwerner's wife, from the beginning, announced that she thought it was just tragic that it took the death of these white young men for the nation to pay attention to the murders happening in Mississippi.
I have a question that kind of follows on this, and I'm by no means an an expert on this time period in history, but I read and recommend to everyone the graphic novel trilogy March, which was co-written by Congressman John Lewis, along with some others who did the illustrations and stuff. And, you know, talks about this era in the civil rights movement. And I learned a lot about the training that civil rights activists went through to maintain their nonviolent approach to this very confrontational environment. And in one of the letters that you read from Luke, he talks about that and his commitment to nonviolence. And I wondered if you know of, did he have to go, was there any special training that he had to go through? Because the books talk about this actually like very rigorous process that these groups were going through to kind of train themselves to not react when they were like really being threatened and harmed and you know, just treated in terrible ways. And so, yeah, did Luke's letters or Luke's just, you know, from talking with him, do you know anything about that?
Oh, yeah, absolutely. So the orientation was filled with exactly this. There was a tremendous amount of role playing that went on. He wrote about it in his letters. You know, he was keeping daily notes, and he wrote letters almost every single day. So yes, they went through rigorous training, and then at the freedom schools, they were teaching their students. And when Luke went back to medical school on his own time, he continued to teach the methods, you know, the role playing and the methods of nonviolent resistance to high school students who would come sometimes even to his home from East Palo Alto. So when he went back, he lived in East Palo Alto, which was the poor integrated community that was close to Palo Alto, which was where Stanford was Lily White. But yeah, I think a lot of the people from the Freedom Summer went back up north and continued to teach the methods. And as I said, you know, unfortunately, many were disillusioned because they weren't able to persuade, you know, the Democratic liberals to certify their attempt to unseat the regular party.
I want to thank you for bringing the New York State situation currently to the group. When Ken Screven, the local news personality, was dying, he was sent to a rehabilitation facility only about an hour and a half, hour and 45 minutes west from here. And in talking with his family, I mean, I visited multiple times, but his family said it was quite distressing to come up from Maryland and then having to go into rural New York with many, many stars and bars flags being flown and really cruel anti-Biden sentiments. And they said they felt really unsafe in this part of New York State.
It's horrifying. Now, in Columbia County, we have something called the Hate Watch Report. So I sent you know, a photograph of that sticker to them, but there have been White Lives Matter and Oath Keepers meetings. And we used to have neighbors next to us, an interracial couple, and Kim, who is African American, she felt unsafe. You know, they were weekenders and their home wasn't, you know, they had lights and they had cameras. And she felt that, you know, these awful looking trucks were, you know, pickup trucks were coming into their driveway when they weren't there. And she saw Confederate flags around. It's terrifying.
Just a question. So one of the big outcomes of Freedom Summer was the passage of like the Voting Rights Act of 1965.
Yes.
Unfortunately, the Supreme Court in recent years has like ruled parts of that unconstitutional. Like, I don't know. How do you feel about that? Like your brother having participated in this?
Well,
struck down.
Yeah, it's I mean, what's happening is awful. right? It's happening in most of the states where the Republicans are in charge, and not just in the South, that's for sure. So no, it's awful, and it feels terrible to have to relitigate things that were settled or seemed to be settled, and the same could be said for the Dobbs decision with abortion. But I think it does take organizing and sort of a groundswell of folks who are concerned, and also a change in political leadership. Yeah, but he would have been distressed, of course.
Go ahead, Leva.
Quick question. Wait, can you hear me?
Yeah, we can hear you. Go ahead, Leva.
Can you hear me?
We can hear you.
Okay, thank you, Julie. You can?
Yes.
Okay, Julie, thank you so much for a superb presentation. So moving, very moving. I am thinking that, or remembering some years ago, we heard on news, actually NPR, about the still relatively high, very high infant mortality rate in Mississippi. And we actually had our medical students do an exercise about that, looking at the social determinants of that problem. And I'm wondering, do you know what efforts have been made since Freedom Summer? What is currently, or in the last few decades, going on to help improve the situation? Are there health professionals involved trying to do such good things as Luke did and others?
I think that there are attempts. I think that when you think about the social determinants of health, unfortunately, there's still the situation of great poverty. And Mississippi is sort of like a desert in terms of growing vegetables, although it's an agricultural state. It's all about export, and it's not growing vegetables. So you go to grocery stores there, and it's like a vegetable desert. Recently, I had found an article in the New York Times that was about Alabama and how they were closing now birthing centers that have been very important with midwives, where Black mothers feel more comfortable and are paid, attention, and they're closer to their homes where they can see see a doctor instead of traveling 40 miles or whatever. So I think the lack of clinics is still a huge concern. On the other hand, I read in DeShazo's book that there are now 22 federally qualified health centers in Mississippi that serve almost 300,000 people. However, that's a drop in the bucket if you look at the population of the whole state. And I think, the lack of Black doctors is a big concern.
Thank you.
Sure.
Much more work to do, in other words.
In other words, lots. But I wanted to tell you some of the positive outcomes. So it wasn't all just negative.
No.
Thanks so much, Julie. I just had actually a quick question. Yeah, this was a really richly told story and narrative. So I really appreciated it. I mean, I guess I was a little shocked and also unsurprised in some ways about the apology that the AMA gave in 2008, and then you mentioned that it wasn't until 2015 that the Mississippi State Association sort of supported that apology. I was wondering if you read anything or have some insight into some of the politics behind the sort of the delay. I mean, what were some reasons that the Mississippi State Association was giving for not supporting it or being so late?
Well,
Curious.
yeah. I don't know. I think I have a book where I could find out. John Dittmer was a wonderful, wonderful historian, and he wrote a book called The Good Doctors, which is about these Black physicians in Mississippi who who were at the forefront of this whole Freedom Summer effort and the Medical Committee for Human Rights. But I think, I didn't go into all the details.
Yeah.
The AMA first excluded Blacks in the early 20th century. They permitted Blacks to join as scientific members, which meant that they could not vote and they could not attend social occasions. So when they would break for lunch or dinner, they were excluded. And they listed Black physicians in the AMA book with a COL for colored after their names. So they were identified. And I think that what happened and has happened in Mississippi is people are reluctant to change, unfortunately. And it took until 2013 for the state of Mississippi to accept the amendment that bans slavery, right? So it took until the same sort of time period, another 2 years for the Mississippi State AMA to accept that apology. I mean, it's a very sad history. And there's a wonderful book. What is her name? The woman who wrote, she wrote The Caste System, and it's about the caste, how it's we really have a caste system in this country, and it continues. And Andresa has said to me, people ask me, will we have equality? She said, I don't think we ever will. And that's that's heartbreaking.
We are at the hour. I see, Wayne, that you have your hand up. I'm happy to, I actually have a 1 o'clock meeting, so I have to hop off. I'm happy to turn it over to you though, if you want to continue the discussion. Would you like to do that, Wayne? You're muted, Wayne.
I'm happy to do that. I accidentally raised my hand.
Oh, you did? Okay. Right.
But I'm happy to stay on a minute if anybody else wants to.
I was mainly going to hold it open for you because I thought you had your hand up.
No,
So,
all right. But to Daniel's question, I'm surprised they ever apologize at all. So that's just my 2 cents. But anyway.
Maybe I'll just thank Julie then.
Yeah.
And thank our audience. So thank you, Julie, for your presentation. Thank you, everyone, for your questions. It's been great to have this opportunity to know about your brother and learn more about the history of the civil rights movement and how we can think about it in the current moment today. So thank you so much. Thanks, everyone. And we'll see you next time.
Thank you.
Great. And thanks for the opportunity. Bye.